Oh boy, where do I begin? We're still in 2023, but before I get into that, this is the personal chef, Renee, also known as Eating with Food for Thought Roberts, and also known as Renee's Champagne Nights. Two platforms, Eating with Food for Thought Roberts and the personal chef, Renee. We are all one in the same. And Champagne Nights, that's a totally different story. So we'll talk about that later. So I'm going to get into what I came on here to talk about. What I want to discuss is convalescent homes. Convalescent homes. If you have a parent or anybody, a loved one, it could be a good friend, it could be whoever. If you have someone in a convalescent home, please, 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 I can't stress this enough. Make sure that you are checking on them. Don't let it be that you know someone in a convalescent home and you go up there periodically, well, at least you go sometimes. You don't go all the time, but you do go. And when you go, don't just go up there and sit. My father was in a convalescent home, and Daddy was there for wound care. Every time my dad was in there, he was there for either wound care or he was in there for rehab. Don't just go there and sit and just visit like you're watching paint dry. Do you know how boring that is to watch paint dry? Paint the wall. Now we're going to sit here. We're going to watch it dry. Don't do that. Don't do that. Don't do that. You got somebody in a convalescent home, always ask questions. The people who work there, I'm going to say the CNAs are some of the hardest working people in the convalescent home. The LVNs, they distribute the medication. Then you may have one or two RNs on duty. They do things that the LVNs can't do. They're very understaffed. They don't have enough people working for them. And even with them being understaffed, that's still not an excuse for me. If you understaffed, then you need to hire some more people. You need to pay people a living wage, because best and believe the people who own the facility, the administrators, they got that living wage. But you want to work the hell out of the CNAs. They running here, running there, running here, running there, like they track stars, like they Flojos. Or what's her name? Marion Barry? I don't know. The girl that could run real, real fast. Her name was Marion something. It's like they're track stars and they have patient after patient after patient after patient. Somebody is going to get pushed to the side. When my dad was in the convalescent, this last time was the worst time. He was there for wound care. And it was horrible. It was horrible, horrible, horrible. I wasn't ready to deal with the wound care because I wasn't sure, what to do. But I learned what to do. My father almost died while he was there. He literally almost died. And he almost died right in front of their faces. And I came up there to see my dad one day and I said, this is different. I said, what's going on? Oh, he's not eating or drinking. And I said, and when was the last time he was eating or drinking? Oh, he hasn't eaten or drank anything in over 2 weeks. I said, wow, really? I said, it's been 2 weeks since Daddy had something to eat or drink? Yes, he won't eat, he won't drink. I said, well, did anybody think to call 911 and get him to the hospital and get him evaluated, or call the doctor on duty to get him evaluated? Well, we don't have a doctor on duty tonight. I said, somebody's in charge. So they sent a RN, a registered nurse, over. And she asked me, what's the problem? I said, look at my father. I said, my father looked like he may have had a stroke. I said, my father's sitting up here looking like death. I said, my father looks like a skeleton with skin draped over his body. I said, that's what he looks like. I said, my father looks like he's going to be deceased within the next 24 to 48 hours. I said, get him out of here. Call 911 and get him to the hospital. Now, in those 2 weeks that I had not seen my father, I wasn't in town. I was gone. But as soon as I got back, I went straight up there to the facility. And I said, had I not gotten back when I got back, my father would have died. The nurse calls the hospital. She calls Kaiser. And she says, we have a patient here, and the daughter, you damn Skippy, you damn right. The daughter wants him brought in and evaluated. Well, what's the problem? What's the signs? Oh, well, we really don't know what's going on, but she says that he's not looking good to her and that she wants him evaluated. I said, please call 911. Please get somebody over here to get my dad. And she said, we're doing it, ma'am. We're doing it right now. 10 minutes later, ambulance comes in, whisks my daddy on to the hospital. Now, mind you, my father is just laying there, mouth open, eyes closed, face all sunk in, looking like death. My father looking like death. They got him to the hospital and immediately started working on him. 3 doctors came to me and said, had you not been there, had you not gotten your father here when you did, they said it was going to be all bad. They said your father was not going to make it. He was not going to last a few more hours. Your daddy would have been gone. They worked on him. They got daddy all back pumped up and everything. They got fluids in his body. Now, you're working at this facility and you see a patient that looks like he may have had a stroke, he or she may have had a stroke, something seriously wrong. You not thinking? Call 911, get somebody up in here, see what the heck is going on. I'm sure they have good convalescent homes and they have not so good convalescent homes. Somebody got to do it. See, because when it comes to our parents, everybody doesn't want to be bothered with their parents. They in their own lives. They want to do their own thing, and it's nothing wrong with it. If you didn't sign up for the assignment, you didn't sign up for the assignment. I signed up for the assignment, okay? Did my father get on my nerves? My father got on my last nerves. Well, before my father got sick, my daddy used to work my nerves. I said, Daddy, you know you're going to get put out. I said, if you don't stop it, you're going to end up getting put up out of here. And your parents will work your nerves because my daddy worked my nerves. But in the process of him working my nerves, I still enjoyed my father. I still like being around my daddy. I still like doing things with my dad. And when my daddy had 2 strokes over the past couple of years. My father had 2 strokes. Okay, so he ended up in the hospital. He's back and forth in the hospital, back and forth in and out of the convalescence. You know, he needs rehab. Even at this last visit to the hospital, they were telling me, oh, well, when is he coming back? I said, he's not coming back. Oh, you're not going to bring him back? I said, no, I'm not bringing him back. I said, I'm his rehab. He going to rehab it right there at home with me. I said, my father is not going to die in here. My father will not die in here. I said, when my father dies, I said, he going to be with me. And I said, and hopefully we going to be at home. I said, my daddy going to die at home. I said, my father's not dying up in here because my father was sick. My dad was sick. I mean, sick. My daddy was death sick. Rewind it. Let's rewind. Let's go back a little bit. Let me give you a little update. My father went into the hospital February 14th, 2023. I knew something was wrong that day. I had daddy up with me all day. I said, Dad, you're going to stay up with me. We're going to visit, blah, 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 blah. I want you up in here with me. Something was wrong. Something just seemed like it was all of a sudden. And then I said, you know what? I better call 911. I said, because something's seriously wrong. And I can tell when there's something wrong with my dad. So I called 911. They got there within a few minutes and they started evaluating him and everything. And then they said, we're going to get him to the hospital. And they said, we're going to take him to the closest hospital, which was Memorial Hospital around the corner from the house. They take him around the corner to Memorial. Memorial calls me 2 hours later and they tell me, they said, your father has pneumonia and he has COVID. I said, pneumonia and COVID? I said, how the hell did my dad develop COVID? I said, he hasn't been anywhere. I said, we got nurses coming in and out. We got caregivers coming in and out. You know, it's always people in and out, in and out. So I'm calling, trying to find out where the hell did my father develop COVID from? Where did my dad get COVID from? I tested myself. I gave myself 3 home COVID tests, but I didn't trust it. So I said, you know what? Let me go to the hospital. I called the hospital, made an appointment, went up there. I said, I need a real COVID test. So I got a COVID test from them, negative. They said, you're negative. Talked to everybody who had been in and out of my house over the past couple of weeks. Everybody's negative. Everybody's negative. One person told me that they had been feeling a little sick, that they had a cold. And I said, wow. I said, you have a cold? And they said, yeah, I've been feeling sick, but I took a COVID test and it was negative, but I'm going to go to the facility and take one. Well, they went to the facility and took the COVID test, and the COVID test came back positive. So that's where my father contracted COVID. Now, this was not, no one gives somebody COVID intentionally unless you just a dirty low down dog. Now, if you a dirty low down dog, you will have something and you will give it to somebody because you don't give a damn, you know, but not this person. It's just something that happened, you know, and I can't hold them responsible for it, but I'm still pissed off about it, but it's something that happened. So daddy ended up with COVID. Daddy ended up in a unit where he had to be, the ICU. They had him in the ICU unit. While he was in the ICU unit, they allowed my father to lay up. They said my father had severe diarrhea. They allowed my father to lay up in feces for hours and hours and hours at a time until it ate his backside up. I mean to tell you, it ate his backside up. I'm talking about coming above his behind in the back and coming up his back. They call that a sacral wound. A sacral wound. That's what that was. They had to do surgery on my dad. They did surgery on my father, and they dug his body out. Now, they asked me about doing this surgery on my dad, and I asked the doctor, I said, is this something that's going to help him, or can we go another route? Oh, he really needs his surgery. He really needs his surgery. But what they didn't tell me was that not only did he need that surgery, but he needed another type of surgery because that particular surgery is in his backside area where feces and all that stuff can get it infected. So what they needed to do was reroute his bowels. They didn't do that. They didn't do that. Now, when it got to the point where they wanted to reroute his bowels, it was too late because by this time, my dad is too weak. My father, even after I got him out of the convalescent for the wound care, because he was there for wound care, I said, teach me how to do the wound care. I said, I'm just going to have to suck it up, pull up my bootstraps, put on my big girl panties, and get in here and take care of my dad. I said, because my father is not going back to the convalescent. He is not going back to the convalescent. I say, I got to learn how to do what I need to do to take care of my father. Okay. Not only did daddy have that wound, now you're starting to get bed sores because you're not being turned every couple of hours. You have to be, when you got a patient that's bedbound, and my father was bedbound because he could no longer walk, you got to turn them every couple of hours. They got to be turned. They got to be turned. They got to be turned. When you change that sacral dressing on their backside, or anytime you change a dressing where you're constantly having to change a dressing, you're supposed to put the date that you changed the dressing, the time that you change the dressing and your initials or your name on there. That way, when the next person comes through, oh, I wonder when the last time this person was checked. All you got to do is look there and all the information should be there. But if you never put it on there, they'll just say, oh, they okay. You know, let's let the next shift do it. They okay. No, they not okay. Quit being lazy. No, they are not okay. You got people in the hospital. Sometimes I would go up there and it was like I was in a madhouse. You would hear people, help, help, help me, help me. They just doing this the whole time you're there. And it's like you're in a nut facility. A nut facility. They're so used to it, they ignore it. They don't just go check on the people and stuff. They're like, oh, that's just Mr. So-and-so. Oh, that's Miss So-and-so. You know, they do not check on them. If they don't have to get them up out of bed, they will not get them up out of bed. They will let them lay in that bed, lay in that bed, lay in that bed. And if you lay in a flat position for too long, or if you're not getting up like at least 2-3 times, I'm going to say 3-4 times a week, get up out the bed and sit up. What happens is your lungs start to fill up with water. And that's how you develop pneumonia. I learned a lot taking care of my father. So when my dad called 911 and my dad got picked up, taken to the hospital, he stayed in the hospital for, I'm going to say 2 weeks. And then he came home. And when he came home, twice I had to call 911. The last time he came home, he had just came home that Sunday. The nurse came out on Monday. The nurse told me, they said, Renee, your father has to go back. They should have never let him go. And I said, what do you mean he has to go back? I said, no, no, no. I don't want him going back. I said, he's going to stay here with me. I'm going to take care of him. He's going to be fine. I said, because whatever they could do for him at the hospital or the convalescent, I said, I can do it right here at home. I said, I don't need my daddy going back. I don't want my father leaving me again. He's staying here with me. They said, you don't understand. It's bigger than what you think. He has to go back. This was a Sunday. That Monday morning. No, this was a Monday. This was a Monday. That Tuesday morning, I get a call from the hospital telling me, your father's not doing good. You need to come up here. And I said, this was at 7 o'clock. And I said, I'm on my way. I got there. It's about 7:45. So the doctor comes in and he talks to me and he says, your dad is dying. And I looked at him and I said, I know. I said, I know my father's dying. I said, I understand. And I said, you preaching to the choir. I said, I already know what's going on with my dad. I already know he's dying. But I didn't think he was so close to death that he was dying right now. He says, your father has at best 48 hours. I said, 48 hours? I said, are you kidding me? He said, 48 hours. He said, 72 if we're lucky. He said, but I think he said 48 hours. And I said, okay. So I made a few phone calls and stuff to my brother and my sister, called my mom. It's called a few people and stuff. And I told Dad, I said, Daddy, we started this journey together. We're going to end it together. My father died. My father is no longer here. My dad died July 25th, 2023, this year. We are in October. So my dad's been gone away from me for a couple of months. Okay, I was with him when he died. I had just left his bedside. I was over there talking to him and I was kissing him and I was holding his hand. And then I walked to the other side of the room and sat down for a few minutes. And then the nurse came in and she said, your dad is no longer here. And I said, what are you talking about? I said, I just walked from over there with him. I said, my daddy's fine. And she said, no, your father just took his last breath. And that was at 11:40 that night. So I said, okay. And then the doctor came in about 12:15 and he checked my dad and he said, it's official. He said, your father has transitioned on. Your father has passed on. And my father used to be very rigid and he would hold his arm like this. It was so tight. And then I try to push it down. I said, Daddy, I said, relax, relax. I would rub it and stuff and he would relax a little bit, but he was just so rigid because my father was a very, very strong man and he was like a piece of steel. My father was a steel polisher and he was like that steel, very, very strong, very rigid. So when he died, when he passed away, his body relaxed. The arm just relaxed. His legs were in the fetal position. The legs, they just relaxed. Because I had told them, I said, my dad needs some type of brace on his legs to stretch his legs out. Speaking of stretching something out, my arm, I hurt myself a few weeks ago and, oh God. Okay, I got to stretch this arm out while I'm talking. But anyway, my dad was, I told him that he was going to need braces. So, we were working on a lot of things for my father the day he passed away. I was working on a lot of stuff prior to him passing away. And so he ended up passing away. And do I miss him? I miss him with all my heart. He was kind of like, Daddy was kind of like, my male BFF. Even though he was nerve-wracking as hell and stuff, but when he was sick, sick, it was just like my heart totally changed. My heart totally softened. Super, super softened and stuff. I say he is where he is in life. When I took care of my father, I had to literally bathe him. And when he could no longer walk, I had to bathe him in the bed. I even got a video of me, bathing him in the bed. Bathe Daddy in the bed. And then I would change his bed. He didn't have to get up out of the bed. I knew how to change the bed while he was still in bed. I bathed him while he was in bed. I got him dressed. Everything I did from the bed. His toileting. He can't get up and go to the bathroom. He can't stand up. He couldn't even sit up. If I set my father up, my father was like a newborn baby. He would just fall to the side. He would fall to the side, something like that. But Daddy couldn't even just sit up on his own anymore. But that was okay, so like I said, I did the best I could with him. I did the best I could with his wound care, with taking care of him. And like I said, I love my father dearly. Everybody's not perfect. Nobody's perfect. Everybody doesn't make the right decisions in life. People make bad decisions. They make wrong decisions. But it's the decisions that they make at that time. Everybody. I don't give a damn who it is. Everybody makes bad decisions and stuff, and you got to live with those decisions. You have to live with those decisions. But getting back to the nursing homes, you better really, if you got somebody up in there, you better really, really be paying attention. And like I said, don't just go up there and sit and just visit. Sit and just visit. Don't do that because that's not a good look. When I would go up there with my dad, first thing I do, I stop off at the linen station. I grab linen, I grab towels, washcloths, everything I thought I needed. I go in that room and I go to work because I know they can be trifling as hell. I was holding my daddy's hand one day. I was up there and Daddy kept his hand really rigid and stuff. So, because I had to get him a brace. The doctor ordered a brace for him, to stretch his hand out. And so I was holding his hand and I was rubbing his hand. Then all of a sudden, this odor came up. And I said, damn. I said, what's that? I said, what is that funky smell I'm smelling? And the more I rubbed his hand, the funkier it got. So I smelled my hands and I said, damn. And I looked at Daddy and I did this. I said, damn. Took him back to his room. We went. I got some soap and water in the basin, washcloths and everything. And I commenced to washing his hands. And I told them, I said, how do you bathe a person and you don't wash their hands? I took Daddy to a doctor's appointment. They said they had just bathed him the night before. I said, okay, so he cool. So they're trying to lift the arm up to get the cuff on the arm to do the blood pressure. And so I'm helping the nurse lift the arm up. I thought a damn skunk came into the room. I was so embarrassed. I said, no, the heck they didn't. My father was so funky. That's another reason why I go in and I bathe him and I clean him. I say, because you got to be Renee clean. You can't be hospital clean. You got to be Renee clean. So I'm saying that what I'm saying is check on people that you know are in the hospital. And when you up there visiting, don't just sit there and visit. Have them brush their teeth. Help them wash their face. If they need a haircut, give them a haircut. If they need a shave, give them a shave. You know, and whether they need a bath or not, have them do some hygiene stuff. You know, wash underneath their arms and stuff. Put some deodorant on them. Put some powder on them. Lotion them down because their skin gets very dry and things. Don't be afraid to check their behind, because I'm going to tell you something. I changed so many diapers over the past year. When I tell you I changed diapers, I changed diapers. I'm cleaning poop. I'm cleaning pee. I'm doing it all. And you know what? It did not bother me one bit, because I looked at it as if it was one of my children, that I was cleaning up one of my children or one of my grandkids. And it did not bother me. This is my father. Somebody got to do it. A lady asked me one time, she said, you take care of your father? I said, yes, I do. And she said, how do you do that? How does that feel? I said, what do you mean, how does that feel? I said, somebody got to do it. She said, I'm just saying. She said, I could see if it was your mother, but it's your father. I said, you're right. It's my father. And I don't think nothing of it. And I said, and if you were taking care of your father, you shouldn't think nothing of it. I said, he need his butt clean. So I got to clean his butt. He needs some A&D ointment on his behind. I got to put it there. He needs some baby powder around his private areas and stuff. I got to do that. I got to clean all that. My father's not circumcised. I mean, I got to pull the skin back. I got to clean everything up so that he won't be nasty and get infections. He still got infections. He didn't get as many as he would have gotten had I not been doing what I was doing. But when they're in those places, the LVNs, they're there to dispense medication. The CNAs, they're there to bring the food, to help them get in and out of bed, to give them baths, and they only bathe them twice a week. And during the other part of the week, they not doing nothing. And with my father being so rigid, and you got to really force that arm open and stuff, they're not forcing that arm open. They're probably bathing him. Under here, it's never getting, this part is under here, it's never getting touched, because they're not going to, we might hurt him. We don't want to hurt him. You know, forget that. Get him clean. Get her clean. Get them clean. Do not let your people be up in there and you're not paying attention. Because like I said, everybody got their lives and everybody want to do their thing. And a lot of times people don't want to be bothered with their family members, you know, with the parents and stuff. They don't want to be bothered with them because, you know, they got their own lives. And I understand that, because I had a life before my daddy got there. I had a life while he was there, and I still have a life, and I am going to live my life. I want to get back to work. I want to do something. I want to do something fun. In the meantime, I still want to help the seniors, because I want to do respite care. I want to help the seniors. And I was thinking about doing respite care at my home, but I've kind of put that on the back burner, doing it at my home. I will come to your home and do it, because they need to be in a surrounding that they're familiar with. So I could come to someone's home and I can do respite care there. And also I want to do a fun job. I want to do more than one job, and I want to work for myself. I'm not working for nobody. I want to work for myself. But like I said, when it comes to people in the convalescent, if you know somebody in there, and check on them. And I promise you, check on them and see what the heck is going on, because I promise you this, they are not getting the attention that you think they're getting. Don't be afraid to call a nurse in there and tell them, say, hey, they need to be changed. Even if they just changed them a few minutes ago before you got there. Oh, well, he needs to be changed again. And when they change them, you stand by and you watch everything that they do. Because I know I got on their nerves, but I don't give a damn. I don't give a care. That's my daddy. And when I was a kid, my daddy was the cleanest man in Oakland from head to toe. My daddy was a looker. He was a dresser. My daddy was a sharp dude. Okay. And in his old age, I was not going to let it be anything but what it had been. Okay. Because I said, I'm going to take care of him. When he came to me, he was not sharp like he's used to being and stuff. I could tell he's getting old and he's not taking care of himself and things. And I said, I got to get daddy right. We got to get him right and stuff. And so we went out and bought him new clothes, and, I started making him bathe on a regular basis. He didn't like to do that. And my dad used to take 2-3 baths a day. He didn't want to take 2-3 baths a week. And I said, Daddy, you don't have a choice. You have to do that. You have to take a bath. My father was cremated. I had daddy cremated, and we have not had his burial as of yet. So I'm still debating on when to do that. I'm thinking about the end of the year. And if they don't have room for us at the end of the year, it will be sometime in March. I have not totally decided on it yet. I got to talk to my brother and sister about it to get their thoughts on it. But yeah, check on your people if they're in the convalescent. Like I said, my dad is no longer here. And do I miss him? I miss him terribly. Yes, I do. I miss him every day. And he will always, always be in my heart. But check on your people and, make time. Make time, because we're all getting older. We're all going down that road. That same road my daddy went down, I'm on that road. I'm on that road. Everybody, believe it or not, we all on the same path. We all on the same path. I don't know if you guys saw the movie Soul, when the guy had died and he was on the conveyor belt and everybody was going up. They was going up to the light. He said, I'm not ready for that. And he got off. But anyway, they gave him a second chance and they sent him back. Well, in real life, there are no second chances. So take care of yourself. If your loved ones are in a facility, check on them more often. And when you go, don't go at the same time. Go at different times, because that's what really throws them off and puts them on their P's and Q's. And then if you need to raise hell with administration, raise hell with administration. Nobody's beyond, you saying something to them. They getting all this money and stuff to do what? Give him a pill. I can give him a pill. Take his temperature, do his vitals. I know how to do all that. I learned how to do the wound care. It was something I didn't think I could do. I didn't think I could handle, but I said, if I don't want him in the facility, I have to learn how to do this. He needed a special surgery. That special surgery should have been done when he got the sacral surgery, which now thinking back, I don't feel like he really needed it. I really don't. They insisted that he needed it, but I'm really thinking at this point that he didn't really need that surgery and stuff, because that surgery was his downfall. Him catching COVID and ending up in the hospital was his downfall. Him laying up in feces for hours and hours because nobody wants to go in and check on him because they didn't want to put on that PPE. I think it's called PPE, personal protective equipment, PPE equipment. That was his downfall. That led to his downfall, which I figured I had my father for maybe another 2 to 3 years. I promise you, I figured that, but I didn't. I only had him for a few months, and I kept going over and over and over in my head, because February, March, April, May, June, July, I kept going over the last 5 months. what happened in the last 5 months that became my father's downfall. But one thing I am happy is that he's no longer in pain. That part is over. He's no longer rigid. His body is finally got a chance to relax. Oh, and when he was in the hospital, after the doctor said, it's final, the nurse came in with the body bag. It's a white bag. She brought it to the room. And I asked her, I said, can I help you? And she looked at me and she said, you want to help me? And I said, yeah, I would like to help you. And, put my dad, in the bag. And she said, oh, okay. She said, nobody has ever offered to help before. She said, I've done this many times. She said, nobody has ever asked to help. I said, well, this is going to be the last thing I'm going to ever do for my father. And I said, and I want to help. And she said, okay. So she pulled him over her way, and I spread the bag out and got everything ready. And then I was going to grab him, and she said, oh, be careful because he's very heavy. And I told her, I said, no, he's not very heavy. I said, remember, I've been taking care of him for the last 7 years. I said, I do this every day, all day. I said that he's light as a feather to me. And I just rolled him my way. And then we got everything, done. And then she started tagging him, the 3 tags, the toe, I think the finger, and one right there around the chest area or something. And then she filled out the paperwork, and then she zipped it halfway, and I zipped it the rest of the way. And I told my dad, again, I kissed him before we closed and told him I loved him. And I went home. And that's it. How am I feeling? I'm feeling better than I was feeling, but I'm still kind of jacked up mentally behind, the loss of my dad. But I'm better. I'm getting there. I'm better, and I'm gonna be better. And as they say, this too shall pass, and it's gonna pass, and it is passing. It's passing every day. But one thing I don't do is I do not take life for granted. I'm not taking life for granted. You can't do that. You can't sit around woulda, shoulda, coulda. Get up and get out. Because I made sure that while my dad was with me, that we did things. I enjoyed traveling with my father. I enjoyed taking him places. My daddy was a clownfish, and he was messy as hell. That was a messy, messy, messy little man. And I told Dad, I said, Daddy, I didn't realize you was this damn messy. I said, you messy. Oh, girl, what you talking about? What you talking about? I said, Daddy, you messy. You a messy little man. But that was my dad, messy and all. And I still love him. I loved him then. I loved him all my life. And I loved him in life, and I love him in death. And like I said, and this too shall pass. And with that being said, if you have not subscribed to my channel, this is the Personal Chef Renee, also known as Renee's Champagne Nights. Hit that subscription button, notification bell, comment, like, share this video out with others. Let people know about the Convalescent Homes. Because I'm telling you, a lot of them, they trifling as hell. They may be understaffed, but they need to hire some more people, because even though you're understaffed, that's still, for me, that's still not an excuse when it comes to somebody who I love, somebody who I care about. Get on them. Get on them. And don't just take anything that they say as face value. Go to administration if you have to. Go to the state if you have to. Do what you have to do to get the job done. If you can't take care of them, and everybody can't take care of them because people are busy with their lives. They're working every day. And if you're working every day, you can't take care of nobody at home. You can't do it. So sometimes you don't have a choice. I had the choice because I was retired, because I'm retired. And so I could come on, Daddy, you can come stay with me. I don't, this house is big enough for the both of us. You can come stay with me. And that's what I had him do. Come stay with me. But the only condition I had with my dad, when my brother was bringing him to me, I said, Daddy has to wear adult underpants. My dad told my brother, he said, I'm not wearing no adult underpants. I'm a man. And I told my brother, I said, and even though he's a man, I said, he's still a man with them adult underpants on. I said, now, if he don't want to wear them, I said, he does not have to wear them. I said, but find somewhere else to drop him off because he can't come here unless he wears them. My brother called me back 30 minutes later. He said, Daddy said he gonna wear them, he gonna wear them. And I said, and then he's welcome to come. I said, but and I meant this, if my daddy wasn't gonna wear them adult underpants, he wasn't coming to my house. Not at all. So that's my story. That's part of my journey with my dad. I got some more stuff to talk about, but I just want to talk about them trifling ass convalescent homes and stuff. They trifling as hell. Even when they supposed to be good, they trifling. So you gotta make sure you get there. Tell them to turn them over. You want to see what's going on back there. I always want to know what was going on with my dad. Except because you got bed sores. I said, how you get bed sores? You didn't have no bed sores when you was at home, but you up in here with all this help. And you got bed sores. You at home and it's just me. And you ain't got one. All this help. You got bed sores? Really? I said, y'all got me messed up. Y'all got the game messed up. But anyway, enough about that. Thank you everybody for stopping by, and I will see you on the next video. Thank you.